treatments. Patient was having axillary lymphadenopathy. After the completion of surgery, mastectomy, chemotherapy and radiotherapy, patient was having general compliance problem. Overall general health was in trouble. She was having pain in the right axillary lymph node. Patient was having hepatomegaly, splenomegaly, cholecystitis, and the patient was having on and off mild antarvegi jwara. Such lakshanas were there. So we started treatment 3 months ago, and now patient is very stable, very happy and comfortable. Quality of life is improving. So I thought of discussing about CA breast with all of you. CA breast, it is a commonest cancer in women after the age of 40 to 50 years. CA breast can also happen to men, but the percentage is very less. And CA breast is having information that it is hereditary, runs in the family. There is one interesting information that left breast cancer is more common than right breast cancer. And this CA breast is very common due to the faulty lifestyle, hormonal imbalances, taking plenty of synthetic estrogens, genetic preponderance, smoking and alcohol, passive smoking also, and obesity is one of the cause for CA breast, and mutation in BRCA1 or BRCA2 genes is responsible for CA breast. And it is also noticed that one who is having dense breasts, they are having the chances of getting more of CA breast. Even lymphatic spread is very common in CA breast. So skin and nearest structures, metastasis of CA breast is very common in bone, lungs, brain and liver. These are very common areas for CA breast for getting metastasis. So how will you understand a person is having CA breast? There are few features. Number one is lump in the breast is very common presentation. Whenever patients feels or complains of lump in the breast, please evaluate thoroughly for CA breast at the age of 40 to 50, perimenopausal or postmenopausal. Pain in the breast is also another interesting lakshana complained by patients of CA breast. The pain may be due to mastalgia, mastitis, or some trauma, hit or injuries. And there is ulcerated growth on the breast, reddish hyperemia on the breast, oozing, bleeding on the breast surface, retracted nipple is also one of the easy clinical finding to suspect CA breast, and axillary lymph node enlargement are and general features like anemia, loss of appetite, weight loss. Anemia, loss of appetite, weight loss are very common features of CA breast. And the CA breast, 5 important clinical features of diagnosing CA breast is: number 1, lump in the breast, skin changes in the breast, nipple retraction in the breast, swelling in the breast, pain in the breast. So these are very important aspects a clinical person should check for. The CA breast is common due to the involvement of ducts or lobules. So milk ducts are catching the cancer growth. So it is called ductal carcinoma or lobular carcinoma. There are 2 categories of CA breast. One is ductal carcinoma and there is lobular carcinoma. Invasive ductal carcinoma or non-invasive ductal carcinoma or
This call is now being recorded.
carcinoma in situ, or important categories of oncological classification. One important clinical issue every student of medical science should remember is regular breast checkup program should be encouraged in
This call is
clinic
now
and not
taking
adults. So, three finger test is very simple and easy. No much of technology is required. Only the clinical skilled person is required. Uh, Three fingered test. Take three middle fingers of a hand, palm, and you check the breast for limbs or palpable growths, pain, etc. Even while self breast assessment is also one of the good thing for every woman to check once in 6 months is, and when they are taking shower, when they have applied the soaps, just gently touch the breast and test where any growth is there. Second is in front of a mirror, a patient self-examination. Lift the one upper hand and then keep it back and check for any growth, change in the color, swelling, ulcer, etc. Next is in supine position also, when self-checking women on supine position also palpate the breast with three fingers and make a regular checkup. There are usually 5 grades of CA breast. So, internee working in a hospital or PG should document this. 0 to 3 grade stage. 0 to 3rd stage is usually very good treatable and curable phase of CA breast. 4th stage, when metastasis has started in the lymphadenopathy or lymph nodes metastasis, or the metastasis in the bone, lung, brain and liver, then the success rate is limited. But however, a very good line of treatment is there for CA breast for stage 4 and 5 also, but it is treatable, maintainable and requires a lot of care. HER2 gene is responsible for manifestation of ductal or lobular CA breast. So in HER2 gene, what happens is either amplification of the cell growth or overexpression of the cell growth. So both are vata dosha karmas. You can understand amplification is amplified growth, and overexpression of the receptors of these ductal cells or the lobular cells will make the diagnosis of CA breast. So, whenever you suspect lump, pain in the breast, oozing, ulcer, retraction of the nipple, bleeding, lymph node enlargement, general conditions like loss of appetite, weight loss, anemia, anuloma kshaya, anuloma rajakshma, or anuloma sampraptya kshaya, rajakshma lakshanas will also be there. Then, how to investigate CA breast? Number one, routine history taking and examination. Number two, the mammography, very useful technique. In most of the cases, this mammography is useful to detect the CA breast. Very rarely, inflammatory breast disease only will not be detected in mammography. Otherwise, it is more popular and easily available, affordable test for diagnosing the growth or lumps in breast. After mammography, if you have a suspicion, then further scans can be done, biopsy can be done, fine needle aspiration need not be going that. Directly you can take biopsy studies or send for higher center for diagnosis. Mammography is routinely done in market to encourage the early detection of the CA breast. I have a few patients of the follow-up of almost 15 years. Since past 15 years, we have follow-up of patients. They are very healthy after mastectomy, radio and chemotherapy and Ayurvedic treatment. Quality of life improved. Their daughters got married now. Such patients also I have till today. They are general cases for me. Not CA breast is over. First 5 years of CA breast, you should have a vigorous follow-up. Once CA breast is diagnosed, 5 years patient must be followed for any recurrence or other issues. And CA breast is very well treated by oncology departments. Modern medicine and modern oncology is also having very good result. Ayurvedic treatment parallelly or add-on or after the chemo radio surgery also, Ayurveda Vaidya can help a lot to reduce the complications of chemo and radiotherapy, to reduce the sufferings of the patient, not only the CA breast, after the CA breast completely treated, there will be some health issues and that can be treated. Patient will be psychologically upset, anxiety, depression will be there. For that also Ayurveda role is there. General investigations, specific investigations, staging of the CA breast, and concurrent modern oncological interventions, surgical, mastectomy and lymphadenectomy, then the chemoradiotherapies. After that also Ayurveda can be started, or once surgery is done, then also Ayurveda can be started before chemo and before radiotherapy, or when patient is feeling some non-compliance with chemo and radiotherapy, then also Ayurvedic treatment can be started. Now comes how to think about entering into Ayurvedic line of treatment for CA breast. Quality of life improvement treatment, active cancer management, add-on cancer management, and follow-up cancer management, and Rasayana Chikitsa becomes one of the major line of treatment. Anti-cancer, anti-cytotoxic treatment is very important. Adaptogenic, Rasayana drugs, rejuvenants, Brahmana Shota Hara Chikitsa, Balya Chikitsa, Jivaniya Brahmana Poshana Chikitsa, Ojo Vardaka Chikitsa, Vayasthapana Chikitsa. All these should be tailor-made plan should be done, and some of the useful Ekamulika Prayoga in CA breast. First and foremost drug comes is Bhallataka. Bhallataka can be used as Chincha Bhallataka Vati, Sanjeevani Vati, Bhallataka Ghrutam, Bhallataka Churnam, Bhallataka granules. Anacarnex granules are also tried, and recently we were hearing about one of our guru. He used to tell unpurified Bhallataka Bija is powdered and given in active phase of cancer. CA breast women can be treated with Bhallataka Leha. Amrita Bhallataka Leha is available in the market. That should be one basic prescription, and one of the component with Sarveshwara preparation called Cytocryl 80 as a brand name, and Chitraka Rasayana is also very good for ductal CA breast, and Panchakola Churna, Shatavari Rasayana, and Hiraka Basma Rasayana, Rasasindura, Hiraka Basma, Alaka Basmam, Thala Sinduram can be used. And in diet, actually the Kharjura is one of the best diet for all CA ductal breast cases. And Varahi Kanda, Vidari Kanda, Ashwagandha. These three are very good Posha and Brahmana Rasayanas to prevent the patient's cachexia, shosha, weight loss, and dorbalya, etc. Ashwagandha, Sadapushpi are important drugs to be kept in mind. Sadabahar or Sadapushpi Patrapushpa Churna can be used for control of mutation and other aspects of active cancer. Ashwagandha is anti-tumor, anti-cancer, anti-CA breast drug. Ashwagandha Mula Churnam 12 to 24 grams in a loading dose can be given as one of the promising drug for suppressing the cancer genes. Lashuna is also a very good drug for cancer genes and cancer prevention. Kushmandavaleha, Khanda Kushmandavaleha is also good choice, and Guduchi Rasayana, Jatamamsi Rasayana, Tagara Rasayana, Brahmi Rasayana, they are very good to maintain the psychological or psychotropic effect in case of CA breast patients. And Chitraka Haritaki Leha is also having a potent rasayana effect in the management of post-chemo, post-radio or pre-chemo, pre-radio CA breast patients. Arogyavardhini, Pravala Panchamrita, Raudra Rasa. These are also active rasakalpas which can be given in CA breast patients as a baseline drug before starting the chemo radio, where confusion is there, patient is not able to take a proper decision, they are unable to go to surgical repair. In such condition, Arogyavardhini, Pravala Panchamrita and Chitraka Haritaki Leha, Raudra Rasa, Hiraka Rasayana can be given. And one more promising rasayana in CA breast is use of Lakshmi Taru leaf kashayam. Lakshmi Taru is very effective. Simaruba glauca is a very effective anti-cancer agent which can be given to improve the defense mechanism in CA breast patients for longer time duration. No side effects are there. It can be given for a very long period. So you can cultivate the plant within 1 or 2 years. That plant will be ready for collection or harvesting. And this Lakshmi Taru leaf kashaya, internally Lakshmi Taru leaf kashaya as dhara over the CA breast, Lakshmi Taru kashaya choose over the breast, and Lakshmi Taru Kashaya Sweda, Bashpa Sweda with Lakshmi Taru Kashaya should be given to see a breast, and even in axillary lymphadenopathy, Lakshmi Taru Kashaya Sweda is very effective. That can also be tried. Amalki Rasayana, Guduchi Rasayana, Shilajitu Rasayana, Google Tiktakam Kashayam and Varanadi Kashayam. Two important Kashaya Kalpas, Google Tiktakam Kashayam, Varanadi Kashayam, and then comes is Mahamanjishtadi Kashayam. These three are very, very, very essential Ayurvedic baseline drugs, no side effects, no metals, no toxicity. Any allopathy doctor can be informed that the patient is taking these drugs. There should be very clear explanation to the patient. Lakshmi Taru is a plant-based Kashaya, Ekamulika Prayoga. Varanadi Kashaya, Google Tiktaka Kashaya are also very safe, and Mustadi Kashaya, Mustadi Malapachana Kashaya, Ashtangurdaya Sutrasthana, 15th chapter, that is also very good rasayana to be kept in mind. In case Kanchanara Gugulu can be given in loading dose, Kanchanara Tvak Kashayam, Kanchanara Tvak Ghritam, Kanchanara Ghritam, Vaidya Tapan Bhai was telling about this. Kanchanara Tvak Ghritam or Kanchanara Panchanga Ghritam, when patient is having Apadarpana Janya Lakshanas, Ghritakalpa should be given. Eshtimadu Ghritam, Eshtimadu Rasayanam, Trifla Gugulu, Gandhaka Rasayana are also very good prescriptions when Vrana is there. When CA breast patients are having open wound and Vrana, then Gandhaka Rasayana, Trifla Gugulu, Gugulu Tiktaka or Manjishtadi Kashayam can be given, and Amalki Rasayanam, it is having very fast improvement in wound healing property. Amalki Rasayana, Pravala Panchamrita can be given. Chandanadi Loha can be given when patient is having Trishna, Daha, Ushnata, Jwara Lakshanas. Chandanadi Kashayam or Chandana Savam, Ushira Savam, Sarivadya Savam. When patient is having Daha Trishna Lakshanas, these chikitsas can be used. Jalauka Avacharanam, when patient is having in early stages, you can also, or when Vrana Lakshanas are there, Jalauka Avacharana and the affected CA breast wound can be also tried. Vidya Karma can be tried to improve the local responses, immune mediated responses in CA breast cases. So today, to summarize, we have discussed about the disease, CA breast and Ayurvedic OPD level management or IPD level management. To prevent every year, Vamana Virechana Nasyakarma should be done to prevent the CA breast in suspected family groups. Every annually, once or annually 2 times, self breast examination or breast examination to rule out the lumps in the breast should be done. Fibroadenoma is a risk factor commonly people are afraid of. Usually fibroadenoma of the breast will not directly convert into the cancer, but they are to be screened annually. Mammography camps should be encouraged in all urban and suburban areas. Genetically, who are having risk, they should be treated with rasayana like ashwagandha rasayana, amalki rasayana, Aragyavardhini Vati, even Lashunadi rasayana, Kushmand avaleha, Masha Bala rasayanas. These Masha and Bala are very powerful drugs to increase the immunity, or one who are having risk of CA breast. If mother is having CA breast, the daughter or daughters of any age group should be regularly given Lakshmi Taru Kashayam for 3 months in 1 year. If you keep 3 months in 1 year Lakshmi Taru Kashayam, so they don't get the CA breast gene open up. The HER2 gene or BARC1 and BARC2 gene will not open up. That mutation will not take place in those daughters whose mother was treated with CA breast. This is another important service Ayurvedic Vaidya or Ayurvedic student can develop in their clinical practice. Early detection will give more success rate in CA breast. Modern oncological intervention before starting surgical or chemo radio also Ayurveda Rasayana Chikitsa, Shodhana, Jalokavacharana, Vidya Karma can be done. Or after the surgery and chemo radiotherapy also Ayurvedic quality of life improving treatment can also be planned. And important drugs should be remembered in CA breast is Ballataka Sada Pushpi Patra Pushpa Churna, Ashwagandha Rasayana, Lakshmi Taru Kashayam, and Aragyavardhini, Kanchanara Gugulu, Varnadi Kashaya, Gugulu Tiktaka Kashaya, Shilajitu Rasayana can be given as preventive or prophylactic or palliative care of treatment in CA breast. If there are any doubts, we can take. Otherwise, we can conclude, and thank you one and all.
Hello, sir. Namaste, sir. Sir, any lepa for fibroadenoma, sir?
Yes. Shotagna lepa, what I practice is Shotagna lepa applied over the fibroadenoma, Jalokavacharana, Virechana, and these rasayanas will reduce the size of the fibroadenoma. Lepa is Kalka lepa is also recently I have started using. You can use Dashanga lepa, Shotagna lepa, or Kanchanara Kalka lepa. That is also very safe to use drug in fibroadenoma.
Sir, along with Kanchanara, is it only Kanchanara Churna or anything you add, sir?
And only Kanchanara, alone Kanchanara, or alone Lakshmi Taru, or Shotagna lepa.
Okay, only with water, sir?
With Sukotna Jala or Gomutra.
Okay. Thank you, sir. Sir, this is Dr. Hemlata, sir. I have met you in Artha Ayurveda Hospital, BTM Layouts.
Okay.
Sir. Okay, and I had one case of CA breast, sir. Actually, I thought it was a fibroadenoma. She came with a lump in the breast. She was around 42 years. This was some 10 years back, sir. So I said it is a thing you may have to please undergo mammography and see the surgeon, and then if they say if you want to remove it, get it removed. And so she was a resident of Chennai. She went there and got it removed and came back